Now call this meeting, COVID-19 to order. Madam Clerk, please call the roll.
Alderwoman Davis,
Present.
Alderman Vaccaro,
Present.
Alderwoman Hubbard, Alderwoman Ingracia,
Present.
Alderwoman Murphy,
Here.
Alderman Coder, Alderman Muhammad, Alderman Odenberg, Alderwoman Boyd,
Here.
Alderwoman Middlebrook,
Present.
Alderwoman Clark Hubbard, President Reed.
Here.
7 present, you have quorum.
All right. I'll entertain a motion for approval of the minutes.
I'll make a motion. We approve the minutes of the, I don't know what the last meeting, I
October
don't know,
October
27th.
27th.
the October 27th meeting.
Entertain is moved by the Alderman from the 23rd, seconded by the Alderwoman from the 27th and the Alderwoman from the 13th. Madam Clerk, please call the roll.
Alderwoman Davis,
Aye.
Alderman Vaccaro,
Aye.
Alderwoman Hubbard, Alderwoman Ingracia,
Aye.
Alderwoman Murphy,
Aye.
Alderman Coder, Alderman Muhammad, Alderman Odenberg, Alderwoman Boyd,
Aye.
Alderwoman Middlebrook,
Aye.
Alderwoman Clark Hubbard, President Reed.
Aye.
7 aye votes.
Vote, sustained motion, Alderman from 23rd. We will dispense with line items 5 and 6. Items for discussion, item number 1. We have Mr. Conway from the mayor's office here with us to give us an update on the CARES Act fund pursuant to ordinance 71182.
Good morning, Mr. President, members of the committee. I know that we're in December, and if you remember, the original CARES Act funds themselves had to be expended by 12/30. Well, we always thought it was 12/31. Actually, technically, the law says 12/30. What we have there in front of you is where we're at in all of the categories on the expenditures as of yesterday morning, to the best that we could tell. And we had $35 million in CARES Act funds. We also, I can tell you, we have applied for over $12 million worth of FEMA reimbursements. We've received $2.9 million in cash on that, and they've actually sent us the funds, and they've approved a total of $7.9 million in reimbursement. So we've been very effective getting many of these expenses, at least 75% of the cost, reimbursed by FEMA. There's current legislation up in Washington, D.C. that we're trying to follow. It may have some provisions, we believe that it will, that will allow us to adjust some of the balances as we get closer. As I said, that a 12/31 date for actually spending the funds is the requirement. Now, spend does not mean cut the check. So there are, if it's an expenditure in September, you've got through January of 2021 to pay it. It's expenditure for November, same thing. So when you look down at my rental and mortgage assistance, we hope to continue to process with CARES funds all the way through March 30th. It's a little tricky because I cannot reimburse the people that are processing the payments for their admin time, but I can cut the checks to the landlord. So when we look at that $7 million, that's what we're projecting. We can actually get out the door by March 30th for December's rents or November's rents. Some of the things that are going on at City Hall are also under those same circumstances. All of the new air purification systems will be installed in City Hall, but I'll have 90 days, as long as they're installed by 12/30, to pay for them because our pay processing is a little slow. What we do believe is the legislation in DC has a provision to extend the time for expending the CARES Act funds. This bill, we may know by the end of this week that the $908 billion bill, the omnibus bill, will be going forward. When you look at those differences in the difference columns, I will point out that E&A will, at their December 18th or 19th E&A meeting, make the appropriate transfers so that where I'm overspent in some categories and underspent in others, we'll move those and get those zeroed out. The one big difference is FEMA stopped making some, as a matter of policy in September, with a cutoff date for reimbursing us for PPE and also paying my public safety employees COVID and quarantine time. And we've increased those numbers significantly, but they're numbers that the CARES Act funds can pay for. I will point out a couple of big things. The rental and mortgage assistance, we've paid out 1,505 landlords through yesterday Monday at noon. On the business assistance, we've did a second round of it, and of the 200 grants that could be made, as of yesterday, 161 had been made. There's room for another 39. Definitely those will get done by the end of the year. Those are kind of the highlights that I see. I know that you might have an interest in some of those other things, but I'm open to questions right now, and then I will have the CDA director and the director of health and hospitals and the director of human services category by category answer any specific questions.
Okay, before I open it up for questions, I want to see if you can cover a couple more things. Can you give us an update on the compromise bill in DC and how that will impact us, and also the jobs situation and how it can impact that?
Right, well, you know, that job situation here for residents of the city of St. Louis, you're right, is incredibly important. What I understand is that there's a consensus on two things. One is that they will do 39 weeks of unemployment, and instead of $600 additional dollars a week of federal assistance, it would be $300. Back when we met in May or June, I told you that there were 17,000 plus people drawing unemployment in the city of St. Louis. That number may have gone down some, but that is a big issue, Mr. President, going forward about keeping our businesses open here in the city. And a big part of it was the business grants that we've made, and it seems it allows those businesses to at least keep their doors open. I will tell you one other thing is, towards your idea on the jobs, we did, Slate had $300,000 that they're working exclusively with laid off employees, and their new provider over there is working exclusively on getting laid off employees back into the workforce. So that's slightly different than job training. It's getting people back in as fast as possible. The legislation in DC, and it's important that really you and everybody else keep an eye on the ball here, and I appreciate that. We'll not have a stimulus check. It will have some things regarding rental and mortgage assistance. There will be an allocation, and it's, again, a little bit of a tricky, to the states and then to the cities. And actually, they're saying counties and cities, and we're pointing out right now that City of St. Louis should get both because I'm both a county and a city. 20% and 20% for counties and 20% for cities of 160 billion. And that's based both on population and which will be a consolation to everybody here. We'll also have revenue replacement. And to a certain degree, in this bill, 1/3 of that could be used, 1/3 of the 20% could be used for revenue replacement. But none of that is done yet. But it seems like the consensus are building for those things. And as soon as we have that and we know what it is, then we'll begin to do our planning with our department heads.
Do you know if they're going to include the eviction moratorium in the new legislation?
That's a good question because I know it is on everybody's mind, but my understanding, what I've seen last is that would be in this legislation. And I appreciate that. I know that Judge Burleson is also mindful of that because the next extension that he had given was to the end of the year.
How many applications have we received for rental assistance, overall applications?
We have received over 9,000 applications.
Wow.
And so that would demonstrate the need out there. Now, maybe 30% of them were people who thought it was more like a stimulus check, they were going to get the funds. And that has initially clogged up the wheels a bit. But our goal is to keep this processing all the way through, irregardless of what they do in Congress this week.
All right, and you covered a little bit of this, but I'd like you to cover it just one more time. So what's happening with the workforce development funds?
Okay, so normally most workforce development funds are for training, but what has happened is Slate's provider, EDSI, is exclusively dedicating a program to help laid off workers get back into the workforce. And they'll be spending $300,000 on that. One of the other programs, which is a new jobs, is the solar workforce grant that Slate got and is working with both the unions and Ameren and getting people trained to install and maintain solar panels. We have to expand, Mr. President. We got to expand to respond for the needs of our residents.
Okay, thank you. Now we'll go around for any questions. Alderwoman Davis.
Thank you very much. My first question is, do we have the capacity to do information mailer out to those who are property owners? Because whether they are individual homeowners or investment owners, they need to be clearly aware that there is some assistance. Everybody does not receive information as well as others, but when it's direct and it comes into their home and or direct to their business, it's clear for them, and maybe they could take advantage of this. Because I think a lot of people are suffering unnecessarily so.
And Alderwoman, what we could entertain that would make, if we have 9,000 applications and 30% really aren't qualified, then I have 6,000. The funds that we have available now, between now and March 30th, without any other extensions, would not cover those 6,000.
Okay,
So that's number one. If this $908 billion bill goes through, then we will have, as soon as it goes through, we would be ready sometime early in January, because it'll give us a week or two to look through everything, to kind of come up with a revision. I'd probably call it CARES Act 2. But if you remember, Alderwoman Murphy also sponsored a bill about a month ago to have $2.3 million in CDBG funds be used for rental and mortgage assistance.
yes.
So what we're doing is we're coordinating that coming into play, irregardless if they do anything in DC, right away as soon as I'm done with the CARES monies, so that this program of rental and mortgage assistance will continue on.
Well, that's helpful. That gives some bit of a hope for others. The other thing that I wanted to ask you, first of all, I'm very happy about the tiny homes that you're doing there at Jefferson and Martin Luther King. But I also wanted to say to you that we do have a lot of property owners that want to provide units for homeless or transitional. I have about 4 in my ward that are working with St. Patrick's Center and providing those for them. But I don't want us to stop taking care of the homeless. No one needs to sleep on the ground. No one needs to have that experience, and we need to cure it totally as best we can. So if there's any other way that we can find to attract people to provide homes, whether they donate them to us and they're in good condition, I don't need us to be spending money on rehabbing unnecessarily, and or if they will rent to these units, rent units to us. We just got to find more ways to make this happen. I was appalled when I heard and something the other day. I just didn't get a chance to drive down there and look at it directly. But for anyone to go out of their way to tell people it's okay, you should stay here in this homeless shelter, in the element, on the ground, and here I brought you a TV. Come on now, I don't want to hear those things. I know that we can do a lot more. We've done a lot, but I know we can do more. So I just want to say to you, I applaud what we've done already. I want us to continue to be creative, but I also want us to send a message out to those people who own investment property to definitely give us a hand. Thank you, Mr. President.
All right, thank you, Alderwoman. Alderman Vaquero.
No, I really don't have any questions.
Okay,
I'm just more listening.
okay. I don't know if Alderwoman Tamika Hubbard is with us yet. Alderwoman Ingracia.
Thank you, Mr. President. Steve, can you let me know if there's a process for individuals to understand if their applications have been reviewed, received, and referred to an agency? I've heard quite a bit of, I've had quite a few constituents and had colleagues ask about people getting sort of stuck in the system and not knowing exactly what the status of their application is, and a real unease about trying to figure that out.
I believe that all of the applications, are being processed on a first come, first serve. The website does have, I think the people in the last month or so were instructed that it would be 5 or 6 weeks. We will get to each of them. If there's an impending crisis, you could reach out to Molly in my office, and she does a good job tracking that down. We have asked the main provider, to do some type of reach out when they get the applications. but they're a little bit leery about doing that because they can't predict with accuracy when a provider is going to get it. We have 14 providers doing this, but it still is a time-consuming process. But you can reach out directly to Molly in our office.
I apologize. I don't know who that is.
Oh, Molly Dwyer, she's been here for about 9 months, but she's the one that is doing the oversight out of our office for this. Valerie, over the director of DHS, I mean, she's very busy doing all of the other things. So for me to have immediate access to information that you or someone else may request, I have a staff person in my office directly involved in this program.
Okay, and when you mentioned the main provider and your request for them to send confirmation to an applicant, are you referring to United Way, the 211 helpline?
We would be referring to the United Way gets them and distributes them out. What happens is they don't really, until the provider that is distributed the application and they start working on it, they don't get a ping back in the system that it's that far along. And if you want, I think, it would be better, Molly probably, I'll bring her in a second, and if we've got a specific question for her, she understands the system very well that United Way is using.
Okay, well, I guess then if it's okay, Mr. President, I'll hold the remainder of my questions for Molly.
Okay,
All right, thank you.
all right. Alderwoman Murphy.
No questions at this time. Thank you.
Okay, Alderman Coder. Alderwoman Boyd.
No questions. I just have a comment. I'm glad that you all are focusing on the homeless. And I think that it is good that we're looking at a citywide effort in regards to spreading them out and not have them concentrate on one area, to focus on the city with all the vacant properties we have and landlords having challenges to fill properties. I think that will be a good partnership. So just thank you, Mr. Conway. I appreciate what you all are doing.
Thank you. Alderwoman Middlebrook. Alderwoman Middlebrook. Alderwoman Clark Hubbard. Alderman Muhammad.
Hey, thank you, Mr. President, and thank you, Mr. Chief of Staff. I have one question, and this is in regards to the rental and mortgage assistance. It is noted that there are 14 providers. Can you list those 14 providers for us?
I have a list, and we've been a little leery about sharing those because we don't want people to show up at the agencies thinking they just bypass turning it, going through the application process. And that has been, one of Valerie Russell over at Department of Human Services has been doing this kind of work forever. And that's a concern of these agencies. I'm more than happy to send each of you the full list of who the providers are.
Absolutely.
I mean, it's public information. I just don't want to encourage people to show up at the door. I think everybody's aware that Catholic Charities is doing quite a few of these, but we don't really want people to show up at their door thinking that they're going to get the assistance on the spot when it's a process that's been set up and well documented and seems to be processing the application. But I'll send you a list.
Absolutely. I think just in terms of transparency, I think it'll be beneficial for us to know who's responsible for processing these applications and doing the initial interviews and, kind of going through the red tape in terms of getting our constituents the assistance they need And you are right, Valerie Russell does a fantastic job. Proud to say she is a wonderful 21st Ward resident. So good call with making her director. And I appreciate all the work that she does and all the work that Dr. Echoes does as well in terms of fighting this pandemic. But I would like that list, and I would think that every member of this committee would like that list, just so we know who is processing applications. Because a lot of times we get calls from our constituents asking what's going on with this, and we really don't have the answer because we have not been walked through that particular process. So I would definitely appreciate it, just so I know. I would appreciate that. Thank you, Mr. Chief of Staff. No further questions, Mr. President.
So Madison will send this to you, and she will also give you the, see if Molly can come in. She will also give you the direct contact for Molly Dwyer.
Okay. Excellent.
Thank you.
Excellent. Thank you, Alderman from the 21st. Mr. Conway, do you guys happen to know how many people in St. Louis are on unemployment? Do you have that number? Like how many people?
I don't have a current number, and we will get that for you, Mr. President, but back in May, I know that we had over 17,000 people actively drawing unemployment. And we will get you an updated number from the state of Missouri. It seems to be relatively easy. Here's part of the problem, Mr. President. Once your unemployment runs out, well, you don't get unemployment. And then people that are frustrated with the circumstances because they can't have a job don't even keep searching for a job. So the numbers that you see in the national press about, well, the unemployment is not as bad as it was in March, or those just aren't truly reflective of the circumstances here in the city of St. Louis. I will point out two other things. I know that I'm showing some money left in the contingency column or in the difference. There's a couple of expenses that have not been paid that the city has been absorbing, and that would be overtime cost of the police department, additional Heat Up St. Louis funds. We have 20-something days left in December. That money probably is not available because as FEMA rejects something or doesn't reject, or we have to continue to take it. I think of that $12 million that we've submitted to FEMA, and Nevena, who's sitting across from me, is the person taking care of that. Only $238,000 has been rejected by FEMA of what we submitted. And we are submitting as much as we can to stretch these funds. And then these final funds and the transfers, the president and the mayor and the comptroller will meet in December and make those final determinations to make sure that they move into the right columns so that we as a city can be very proud that we've effectively, efficiently, and most humanely expended our CARES Act funds for the best interest of our residents.
All right. Have you all received any information related to the rollout of the vaccine at all?
And that would be for Dr. Echols. And I'm going to turn it over to the doctor now in case you've got a question. Besides, he'll answer that question. And then on anything that his department had in the way of funding.
Okay.
Good morning, Mr. President and the board. Yes, we have been having ongoing discussions with our state, federal, and local partners, particularly with the hospital systems and the federally qualified health centers, to make sure a distribution plan is in place to ensure that when the vaccine is available for city residents, that we will be able to distribute it effectively. So, as you all know, the health department doesn't provide direct clinical services, so we'll be working with the federally qualified health centers as vaccinator sites All of the health centers have submitted their application to the state so that they can receive COVID-19 vaccine. We've also been working with the corrections facilities to make sure that they can also receive vaccine for staff and inmates when it becomes available. So far right now, right at this point in time, we're as best positioned as we possibly can be until the vaccine is available. One challenge that has come up around one of the vaccines, particularly the Pfizer vaccine, is the need for super cold storage, and so we've been able to secure super cold storage units for our facilities to make sure that when the vaccine is available, they'll be able to properly store them so they don't go to waste.
Any idea on, when we would see a rollout begin in the St. Louis metropolitan area? I know it's hard to determine right now, especially since we have a president that isn't being exactly cooperative, but any idea?
So Moderna and Pfizer both submitted their applications to the FDA for approval. That approval hasn't been granted yet. The United States Association, the Community on Immunization Practices, is slated to meet on the 10th of the month, and that's when we expect them to make a decision.
The 10th of December?
10th of December. Mm-hmm.
Okay.
And so if the vaccines are approved during that meeting, more than likely we can expect to receive the first shipment of vaccine within 7 to 10 business days.
And then how are they going to prioritize it? Will it be, hospital personnel first? Will it be senior centers first? Will it be people with, in high risk categories? I mean, how are you going to prioritize it once we receive it?
All right, so the Centers for Disease Control and Prevention have established the tiered approach. So there's a Tier 1A and Tier 1B, which are the top priorities. The Tier 1A will include those individuals who are a part of critical infrastructure, particularly medical workers, so healthcare workers, so physicians, medical staff who are on the front lines, because they're more likely to be exposed to COVID-19 because of their line of work. Then you have Tier 1B, which includes those individuals who are elderly, so those individuals who are 65 and older, because they are more likely to experience severe COVID-19 complications.
And how are we going to get the word out so people know where to go, who to call, or whatever? How are we going to get the word out, especially for people who are uninsured or underinsured?
Absolutely. So we start having those discussions as well with our regional partners. We've been having discussions for months among the St. Louis Metropolitan Pandemic Task Force to make sure that hospital personnel, medical personnel are aware of when the vaccine is available, because they'll be the first to receive it. And then we're also looking at the larger scale, so making sure that we're able to get information to laypersons in the community, so they'll know not only when the vaccine is available, but how to obtain the vaccine. But more importantly, we also want them to be able to access information about the safety of the vaccine, because that's going to be a huge barrier for individuals. If they don't understand that it's safe, then they're less likely to actually get it. And so we want to make sure that we have accurate information available to all stakeholders across the city of St. Louis, because we want to make sure that they're able to, one, make informed decisions about their health. So if they opt to not take the vaccine, that's their choice, but we want to make sure that they have all the facts and all the information available to them so they can make an informed decision for themselves and their families.
Okay. All right. I'll go around the list. Alderwoman Davis, any questions?
Dr. Eccles, I just wanted to, first of all, commend you on your work. I'm a member of the outreach committee for BJH and BJC. And of course, a lot of information comes back our way because they want to know how we can reach residents and get information to them, and also have the presence of the medical institutions in our community even more. I know that you had shared with us a while ago about some what do you call it? The tracing. That's what I'm concerned about. How is that going now? Do we need more staff to do that? Because I know that has a lot to do with containment and slowing this pandemic down. So that's my question. I'm really concerned about the tracing.
And so we have hired staff, and we continue to onboard new staff for contact tracing. Right now, staff have been able to manage the caseload. It's higher than what we want it to be, but they have been able to manage the caseload. And we wanted to make sure, again, that the staff that we hired wouldn't have to be laid off or let go come December 30th, because that's when the funds, the CARES Act funds will end. So we'll be bridging their employment. So we're using community development block grant funds to make sure that they're in position to provide COVID-19 contact tracing and disease investigation through 2022.
Oh, that's important. Thank you. That was my question. Thank you very much.
All right, thank you.
So for the first, so everyone knows, so for the first year, there was $750,000 that were allocated for these positions, and then for the second year, there's another $750,000, and for the third year, an additional $750,000, taking it to rough $2.25 million that are be available to make sure that these staff can continue their efforts through the pandemic.
All right, thank you. Alderman Vaquero.
No real questions right now. Thank you.
Okay. Alderwoman Ingracia.
Thank you, Mr. President. Nice to hear from you, Dr. Eccles. Can you talk a little bit about the WashU contract for predictive modeling and data evaluation and where that is?
Right, so that's a contract, so it's Washington University's Brookings Institute. And so they've done predictive modeling for the nation, and then they're going to be using the current protocols to really allow us to see what the future of the COVID-19 pandemic will look like for the city of St. Louis. And that will help inform our decision-making regarding program development and implementation for COVID-specific initiatives. And right now, the contract has been, we're waiting for it to get fully executed, but it's in the process.
Okay, and do you have an ETA on getting data evaluation back?
Yes, we'll have that data by the end of the month.
Okay, and then on the spreadsheet, it looks like for that response, we've allocated $100,000, $25,000, which has been spent or committed. And then what's the other $75,000 being used for?
Yes, so the other $75,000, so we're repurposing that because there's a qualitative assessment that we're also going to be doing with Washington University that looks at the unintended consequences for those who have been directly impacted and those who have been indirectly impacted by COVID-19. That project will be used to inform decision-making around health and social justice for the public health department. So it will go beyond the impact of COVID-19, but that's going to take more time. But what we are doing is repurposing that $75,000 for testing, because there's still a great need for testing in the city of St. Louis. As we all know, there's more and more people are getting tested, at least lately. So we want to make sure that our FQHCs and our partners have sufficient resources to make sure testing continues to be available for the community at no cost.
Okay, and so all of that money is going to the federally qualified health centers for free testing?
That's going to the procurement of testing resources, so test kits.
Okay, and then I had one more question. So with the contact tracing, can you walk me through what happens when someone gets diagnosed with COVID-19? What they should expect in terms of contact with the city?
Absolutely. So when someone gets a COVID-19 test, there's really two options. So they'll test positive or they'll test negative. For those individuals who test positive, all the mandated reporters are required to submit those results to the local health department and the state. So we've received those, the documentation from the mandated reporters. We will use the information that's provided in the document, so their contact information, demographic information. When we get the report, it's assigned to a disease investigator. The disease investigator will call the individual, contact the individual, ask them a series of questions that's included on the CDC's person under investigation form, which is a standardized form that's used by all local and state health departments when they're investigating cases of confirmed cases of COVID-19. So they go through their list of questions. And then at the end of the questionnaire, they'll also ask them about contacts. So they ask them about anyone who they've had close contact with within the previous 48 hours prior to getting tested. And we'll ask them for the individual's name, their contact information. Then we'll also encourage them to reach out to inform those individuals that they tested positive, and also let them know that the health department will be reaching out to them to obtain more information and to put them on the quarantine to protect the community's health. And so then, once we get the names of their contacts, those contacts are also, they're followed up. So we will call each of the contacts that they provide information for. We'll enroll them in our quarantine monitoring program. And if they remain asymptomatic throughout the course of their quarantine, then they're released to return to normal duties. But we also encourage individuals, just because of the increase in the percentage of individuals who are asymptomatic, we're encouraging individuals to get tested no sooner than 7 days after their last date of potential exposure. That way we can ensure that we have accurate results. And so for those individuals who test positive, if they're under quarantine, they end up testing positive, then we go through the case investigation form for them, because they may have exposed additional persons in the community while they were under quarantine.
Okay, and we're doing that for our own city employees when, if we have a city employee that tests positive, then if they were in contact with other people within that office, they would all be quarantined and not reporting to work?
So not just contact, so we use the definition of close contact, meaning that they've been within 6 feet for 15 minutes or more, and that's consecutive 15 minutes within a period of 24 hours. So anyone that meets that definition is quarantined. And so typically, there's also a protocol that we have in place for city employees. So if an employee in a particular agency tests positive, that information is routed through their chain of command. The appointing authority notifies me, and we make sure they identify all close contacts within their office to make sure those individuals are notified and quarantined. So that's one piece of it. So we get the work-related close contacts, but we also have to get the community close contacts. Those individuals who may live in their homes, the individuals that they may gather with outside of the workspace. So we will follow up with them with the individual directly to get their non-work-related close contact, as well as to confirm their work-related contacts that were reported to us.
Okay, and then how long should someone expect it would take the health department to reach out to them if they were diagnosed with COVID-19?
So it all depends on how quickly we get the lab results. Sometimes there can be a delay in getting the lab results from the mandated reporters. So typically, individuals can expect to be contacted within 3 to 5 days. So that's why we really encourage individuals to quarantine until they get their results, and then we also remind them, if they know that they are positive, to isolate, and that the health department will contact them. The reporting system isn't, in an ideal world, we would get all the information immediately, and we'll be able to contact individuals within a few minutes. But we're not in the ideal. We don't have an ideal system in place, and so there are some challenges that we have to navigate. But we do work to notify individuals and complete our case investigation as quickly as possible, because time is an important factor.
Okay, thanks so much. No further questions.
All right, thank you. Alderwoman Murphy.
No questions. Everything was asked and answered. Thank you.
Alderman Muhammad. Alderman Muhammad. Alderwoman Boyd.
No questions. Everything
Hold
was
on a
asked.
second. Hold on a second. Alderman Muhammad. Alderman Muhammad. Alderwoman Boyd.
No questions. Thank you, Mr. Chair.
Okay. Alderwoman Middlebrook.
No, I have no questions. Thank you.
Okay. Alderwoman Clark Hubbard.
Hey, Mr. President, can you hear me now?
Yes, yes, I can hear you now. Hello? Alderman Muhammad?
His mic is off, but he cut out.
Yes, yes, he's back out again.
All right, Mr. President, while we wait for Alderman Muhammad to join the call again, so
Yeah.
I mentioned the test that we'll be getting to for the federally qualified health center. So we'll be getting 5,000 COVID-19 tests, which will be processed overnight. So we'll be working with the private laboratory to make sure that, again, as we talked with Alderwoman Ingracia mentioned, timeliness is really important, and so the test results for these particular these kits will be received within 24 to 48 hours.
Okay. All right. Let's see. Alderman Muhammad?
Hey, Mr. President.
There you go.
Thank you. I was having some technology difficulties, but I have no questions for the director, and I do appreciate his service and his extraordinary leadership. Thank you, Mr. President.
You're welcome. Alderwoman Middlebrook, one more time.
No, Mr. President, I have no questions.
Okay. Excellent. All right. Mr. Conway, is there anything further?
Okay, I have Valerie, the Director Russell is on the phone. If there's any questions about the Department of Human Services, she's available. You'll have to unmute her. And
Okay.
do you?
City TV can unmute Ms. Russell.
Are Valerie *6?
I've done that. Can you hear me?
Oh, yes,
Yeah.
we can hear you. We can hear you. And I'll just throw it out. Does any member of the committee have any questions for Ms. Russell? One more time. Does any member of the committee have any questions for Ms. Russell?
I do, Mr. President, if that's okay.
Yes, please proceed, Alderman.
Thank you so much. Hi, Director Russell. Thanks for your time today. Could you just give us a quick overview of what we can expect for, I know we've got the tiny home shelters and the warming buses, but sort of what the process is looking like for winter outreach to make sure that our unhoused neighbors have a place to go. And then also, if we are encountering residents who are, or folks who are in our neighborhood who are unhoused, are there agencies to direct them to who've received the CARES Act funding or other funding, or should they contact the city directly, the Homeless Services Program?
Okay, 3 parts to that question. I'll do the tiny homes question first. We are in the process now, as you may have seen on the news yesterday, of placement of the units on the property that the city is entering into a lease for. There will be approximately 50 tiny homes at that location. The operator for the facility, that contract is in play now. In fact, I'll be walking that over this afternoon to the representatives in City Hall for their signatures and review so that we can get that executed. The operator will be the Magdala Foundation. We've met with them, and they are in the process of hiring staff now. In terms of the warming process for winter outreach, the St. Louis Winter Outreach Team, who have participated in previous years, providing additional shelter beds when the temperature drops below 20 degrees or 25 degrees if there's precipitation. Their efforts have been severely reduced due to COVID. In previous years where they may have had over 100 beds available at various locations, this year they're only going to be operating 69 beds at 3 locations. Our office has provided the Winter Outreach Team with all of the supplies that they need, including cots blankets, sheets, paper towels, trash bags, et cetera, to try to relieve them of any additional cost that this effort is going to require. In addition, we are executing a contract with them so that the development and construction of protective screens will be put between the cots within those 3 shelters. So that's the Winter Outreach Volunteer Group. The city has, under its contractual arrangement, various locations that are still taking individuals who are in need of shelter during the winter. The warming bus and a shuttle have been provided by Metro, and those are located at 10th and Chestnut and 13th Street every night. This is a nightly process of engaging with homeless individuals to bring them into the warming bus. Their temperatures are taken. There's a brief questionnaire done with those individuals to determine whether or not they've been in recent contact with someone with COVID. On that warming bus, we have staff members from our department who are contacting the shelters that are participating in the winter outreach to find out how many beds they have available and for what gender. The individuals are then transported to those locations that have available beds, either by Metro or the city's Homeless Services Division's van. That is going on a nightly basis. If individuals who are appearing at that spot for the warming bus have high temperatures, they are transported through EMS to a hospital facility so that they can be checked out. The locations vary every night because, as you can well imagine, individuals will show up at those locations the next night, hoping to secure the bed that they had the night before. Some of these facilities are walk-up facilities, so in addition to our efforts to transport individuals to those shelters, that number sometimes gets reduced within a period of 15, 20 minutes because others have walked up to the shelters. So we're in the process now with the ESG funds that have been made available for COVID to initiate contracts with some additional providers to open up additional winter beds. Those contracts, as I indicated, will be under the HUD dollars. The negotiation of those contracts is occurring now, working on budgets, working on the scope of work. Some of those locations are going to be in facilities that the city may own. Others will be provided through that subcontractor's contract, and they have identified a location of their own. We do anticipate those other beds being available once those contracts are executed early part of January. The CARES Act funds, as you know, that we have been utilizing to provide shelter throughout this process under the pandemic since March. Those contracts go through December 31st. I am working with the mayor's office to make certain that we can, where possible, extend those contracts into 2021 once we know if the federal government is going to make funds available. In the process, those 50 tiny homes may be utilized for individuals who are currently unsheltered. They may be utilized for individuals who are currently sheltered, but if the funds don't become available through the federal government, we will have to move to other locations. So our goal is to make sure that we are in a position to have additional beds available based upon the contingencies of funds that federal government may or may not extend into 2021. And I believe that was Alderwoman Ingracia. I don't know that I responded to the third part of your question. If you could repeat that, please.
Sure. Yeah, I think you did touch on it. I was just curious where to send people if I'm getting requests. Send them directly to you. I think you had mentioned there are 3 providers right now for shelter space, just for the winter outreach portion.
No, they need to come to the warming buses or contact Homeless Services. And I can send that number out to all of the alderpersons. In addition, 211, the phone number at United Way, can be contacted. They link to the staff who are doing outreach in the evening as well.
Okay, and then just one quick follow-up question. Do you have the process by which you're going to determine who is going to stay in the tiny homes once they are in place?
I don't have that in front of me. The contractor, the operator, our homeless services division in combination with the outreach committee under the COC are devising that particular eligibility criteria.
Okay, thank you so much for your time. I appreciate it.
You're welcome.
All right, thank you. Any further questions from Ms. Russell? Alderman John Collins Muhammad.
Thank you, Mr. President, and thank you, Director Russell. Just one quick question. Has there been any coordination with adjacent territories or jurisdictions outside the city of St. Louis as it relates to homeless services? Has St. Louis County worked comprehensively with you to serve this population during this COVID pandemic?
Yes, they have. The city has an agreement with St. Louis County so that individuals who test positive and who are homeless and therefore need to be isolated, the agreement allows for those individuals to be transported, again under another contract that the city has with Abbott Ambulance, to the location where the county is covering the isolation and quarantining of those individuals. As it relates to the winter operations, if we find a family, an individual, and cannot find a bed for that family or individual during our operations, St. Louis County is contacted directly to find out if they have locations within their jurisdiction where those homeless individuals can be transported. And that is the process that's been in play for the past years and is in play right now.
Absolutely. Thank you so much, Director. I have no further questions, Mr. President.
Thank you, Alderman. Any further questions for Ms. Russell? Any further questions for Ms. Russell? All right, thank you, Ms. Russell, and thank you, Mr. Conway and staff and everyone who participated. I think we are done with that section of the agenda.
Mr. President?
Yes, Mr. Conway, please proceed.
Two things quickly. You'll have to start thinking about calling the aldermen in probably in February. If there is new funding, we're going to probably need some special meetings of the board to keep everybody focused, that we can do it. I know that you had previously expressed some interest in the election board, and at the E&A meeting, I think that the mayor and the comptroller and the president, are thinking about March and April, and making sure that everything is safe for our next round of elections. I do have Mr. Moak with me, and I did tell you that I would bring Molly Dwyer in, and she can answer Alderman Ingracia's question really quickly, if you would like. And that's your call. I just throwing out these last things. But Mr. Moak is here if there are any questions for him from CDA.
Right. Any questions for Mr. Moak from CDA? Any questions for CDA from any member of the committee?
Mr. President, I have one.
Alderman from the 19th.
Thank you. Mr. Moak, I do know that there's funding for construction for affordable housing. And I wanted to ask you if we've had any proposals yet, because I think that's critical as well. We have a lot of, most especially single family moms that need to be in a better position as far as housing is concerned. So what do we have on that so far?
Yes, Alderwoman, we intend to issue what we call a NOFA. I know you know that term,
Yes.
Notice of Funding Availability, which is going to include at least $5 million. That's what we've pledged toward affordable housing during the pandemic. It's going to consist of CDBG CV funds, which are the emergency funds that you appropriated on July 7th. There's also a link to the Affordable Housing Commission to support projects that they are looking at right now to fund in 2021. And we also, as you may recall from the HUD's committee, increased our appropriation generally in the affordable housing area looking forward to 2021 because we know of the need. The housing piece of the pandemic response, however, is certainly the slowest moving of the other things that we've had to address: rental assistance, utility assistance, food, seniors, et cetera. So I'm hoping, and I've talked with my staff about having a NOFA out with funding from these various sources, possibly this month, but I think January 2021 at the earliest.
Okay.
And my hope is with that NOFA to not only address general affordable housing like we always do, but to also zero in on what I would call COVID projects. Could be elderly housing, senior housing, it could be transitional housing for the homeless, things that directly tie to COVID in that NOFA as well. So we're getting there. I don't have that NOFA out yet, but I anticipate having it out, say, in the next 60 days.
All right, thank you. I'll share that with some people who can provide us with some housing. So I thank you.
Appreciate
that. Was my question.
Any further questions for Matt? Any further questions for Matt from CDA?
If I may, Mr. President.
Alderman from the 6th, please proceed.
Thank you. Hi, Matt. Thanks for your time today. Can you give us a quick update? I think that St. Louis Development Corporation's Business Assistance Fund is under CDA, and I know we allocated some additional funds. Are you able to give an update on the expenditure?
Right. So initially we went in with $4 million to support small business, and that had been expended in its entirety, roughly 60 days ago or so, with a few wrap-up notes. And then, of course, you may recall in the last 60 days or so, E&A appropriating contingency funds specifically for SLDC as it relates to the hospitality industry. And that amount was $1.25 million. I understand that is rapidly being spent as well. And I do have some numbers from SLDC here if you'd like to get into them. But overall, I know our task was to oversee that program, make sure we had federal compliance, but most importantly, CARES money to have expenses incurred and ready to go out the door by 12/30, and we are on track to do that.
Okay, and then the last question is, can you provide a quick update on the Sobering Center allocation of funds?
So, Alderwoman, I'll do the Sobering Center. They have the various charitable organizations and the mental health groups and whatever have all agreed to this in principle. What has happened is, under the CARES Act, the city's share of the money that we originally allocated to the Sobering Center will not be spent before 12/30. It took a long time to put together the 3 or 4 organizations that are going to operate this. And so we will have to take our share of the Sobering Center funds out of general revenue, or possibly what will be in the next run, because the law says that if it's physical improvements, and that's what the city was going to do to the site, that they must be completed by 12/30. And there is no way that the city's portion of the contribution to that program would be completed by 12/30. So we're going to do a little workaround, but we're going to continue with that program.
Okay, and then where is that $365,000 that was allocated for the project intended to go?
So it's sitting there on our sheet right now still. And so what'll happen is at the next DNA meeting, you can see we have some negative numbers on this sheet. We will make the transfers to zero out all of those numbers so that when I get to 12/30, there will be no differences. You know, we continue to monitor daily the rental and mortgage assistance, each of these numbers, because I have 22 days left in the month, but I can't predict that accurately what the final numbers are going to be in every category, and then ENA will make the final transfers. But the sobering center is something that we have a strong commitment to. Wilford Pinckney is working very, very hard on this program, and we plan to go forward with it.
Thank you.
All right, and I have Molly Dwyer, and she'll give you a quick idea on how to check up on the rental and mortgage assistance.
Thank you. So anyone who applies online for rental and mortgage assistance, which is about 95% of the applicants do apply online, as soon as they do that, they're sent an email that says your response has been recorded. And then if that application is referred out to an agency, if the agency accepts it, which means, yes, I'm willing to start actively working on this case, then the applicant is sent an email that says, hello, Molly, your application has been accepted by Catholic Charities. You can expect to hear a response within whatever their timeline is, usually a week. For the most general answer is to call 211 if you are looking for a status update. In early October, we updated the website to say if you applied starting today, October 7th or 8th, you can expect your application to be referred out within 6 to 8 weeks. So anybody who's applied in October, November, or December, it's likely they have not been referred out yet. But for those who have applied before then, you know, August or September, they should call 211 if they have not heard anything yet, and 211 should be able to give them a quick update.
All right, thank you.
Thank you, Mr. President.
All right, thank you. Thank you, Molly. All right, anything further, Mr. Conway, before we move on?
We appreciate all of the support of the Board of Aldermen, Mr. President. We appreciate your efforts to make sure that we can keep these meetings going, and your willingness. I know that we will end up having to call on the aldermen in January and February for some special meetings.
All right, thank you. Thank you for the heads up, and thank you for the presentation and the updates. There was also a request for an update from Mary Goodman about the surveys that were sent out to city employees. Mary, are you there? Do you have an update you can give us?
Yeah, I have a quick presentation I can share.
Okay.
Okay, so as you know, a few weeks ago, there was a request to send out a survey to city employees about COVID-19 in the workplace. So we utilized the community group on our emails to send this flyer out, which asked city employees to fill out the survey. It was completely anonymous. It was open from November 9th to November 20th through Google Docs. We received 378 responses. So I'm just going to go through each of the questions. Do you feel the city of St. Louis is sufficiently supporting you during this pandemic? Yes, 36%, no, 48%, and other 15%. Some of the other comments were, I believe they're trying, but the lack of written guidelines and the way different departments handle it isn't fair. Another comment was the city should be consistent across all departments as much as possible. Do you feel safe in the workplace? Overwhelmingly, or about half people said no, 30% said yes, others said 16.9%, Some of the other comments were, with so many employees contracting COVID that work inside and outside of City Hall, access to the building is concerning. Not 100%, a real policy would be nice. It also, another comment was, it depends on the day. I believe it would be helpful if there was more communication around the infection rate of city employees. Are you and your coworkers required to wear a mask? 88% said yes, 11% said no. Do you feel that you have adequate amounts of PPE? 57% said yes, 29% no, 13% said other. Most of the comments said we've been able to order hand sanitizer and masks as needed. What happens if you or your coworker does not comply with wearing a mask or abide by other social distancing guidelines? Primary response was nothing or not much. So here are just a few comments. Some people say that if they report it to their manager, that an email will go out asking people and reminding people to wear their mask and social distance. Do you feel comfortable communicating concerns or making suggestions to leadership? If yes, have they been addressed? 40% said other, 38% said yes, 19% said no. Some people said that they make comments, but it seems like their comments are ignored. One person said yes for their immediate leadership, but it feels like suggestions get bottlenecked the higher up they go. During the initial shutdown, did you work from home? If so, were you able to perform your job duties adequately? It was a mixed response. 360 people answered this question. It was not a required question. 40% of people said yes, they were able to. 39% said no, they were not. A lot of people who said no, they were not, were your kind of frontline workers, refuse, EMS. Some of the items that were discussed was that people have been having to use their personal Wi-Fi and cell phones. One person said the city uses too much paper, which makes it difficult for them to work from home. Many people were able to work from home, though, with limited visits to the office. Do you feel that you can perform your work duties from home? If so, have you been offered that option by your supervisor? 364 people responded to that. 48% said yes, they can perform their duties at home. 29% said no. Of those who said they could work from home, 39% of them were not offered that option. And then some of the comments, additional comments on that slide, were that some people were allowed to work from home only if they were in quarantine. Another person said the city's mainframe is not accessible from home, so it's difficult to work from home. And then said only certain employees are allowed to work from home. Does your department have staggered work days to limit the number of employees? 25% said yes, 57% said no, 17% said other. Some people said that they had staggered work days in the beginning of the pandemic, but then towards the end or around this time, it's kind of gone by the wayside, and they've asked for those to be back in place. This was sent out prior to Thanksgiving, so this question was before actual holiday weekend, but they asked if anybody was planning or traveling, visiting, or having guests at their home. 24% said yes, 64% said no, 11% said other, and most of the other were yes, me and my small groups, or me and my spouse, or very specific responses. What is working in the workplace to help handle the COVID-19 pandemic? 324 responses. The common themes were working from home, encouraging the social distancing, wearing masks, and then limiting access to office. There were some requests that City Hall go back to the lockdown it was in the beginning of the pandemic to limit the amount of public inside of City Hall. And then how can we improve your experience with handling COVID-19? Common themes: increasing transparency when coworkers test positive and implement contact tracing within department, go back to skeleton crews or staggered schedules, and create a policy for quarantining. Rules vary from department to department. That kind of was the same comment that came across with sick time policies for employees. People are confused on if they have to use their sick time, do they have to use disability? So it sounds like from these responses, a consistent policy is what's being requested. And I believe that was it. So I'm happy to answer any specific questions, but that was the
The
breakdown.
data kind of speaks for itself.
Yep.
And we'll make this available to everyone. Any comments before we move on? Any comments before we move on? I'll go through the list real quick. Alderwoman Davis, any comments?
No comments, thank you.
All right. Alderman Vaquero,
No comments.
Alderwoman Hubbard, Alderwoman Ingracia.
I just wanted to say thank you to you and your staff for undertaking this. And I guess it seems like there's some important data that we might want to take a look at to see if we can help increase people feeling safe, and people encourage employees to do the right thing in terms of safety precautions. So if I can be helpful with that, let me know.
I absolutely will. Thank you, Alderwoman. Alderwoman Murphy.
No questions. Thank you.
Okay. Alderman Muhammad.
No questions, Mr. President. Great job, Mary.
Thank you. Thank you. Yeah, awesome job, Mary.
Thanks.
Alderwoman Boyd.
I don't have any I do have one question. Do we have a next step on how we're going to address this? And I appreciate Mary taking the lead because she did send out to us for us to see if we had any questions we wanted to do for the survey. So I'm glad that she did push forward and not wait on us to figure out what we want to say.
Do with it.
Yeah, but I'm glad that she did. And so I just wanted to know if we have next steps, and I would be willing to work with her if she had any next steps she wanted to do.
Okay, all right. And we will be back in touch with everyone about next steps now that we have all the data compiled. Okay, thank you, Alderwoman. Alderwoman Middlebrook.
No, I have no questions. Thank you.
All right, and Alderwoman Clark Hubbard, I don't believe is with us. All right, thanks, Mary. We greatly appreciate it. Good work. Let me get my agenda here. Would anyone like to make a motion to excuse? Madam Clerk, do you have the list of all the people we need to excuse for the day?
Yes, I do. Alderwoman Hubbard, Alderman Porter, Alderman Oldenburg, and Alderwoman Clark Hubbard.
Would anyone like to make motion that we excuse Alderwoman Hubbard, Alderwoman Clark Hubbard, Alderman Coder, and Alderman Oldenburg?
I move that we excuse aforementioned.
Been moved by the Alderman from 13th and seconded by the Alderman from the 6th. All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Any further announcements? That's an announcement.
That's an announcement. That's terrible.
All right. Well, since you're up on camera, would you like to make the motion to adjourn?
I would, and take a nap at the same time.
All right. Moved by the Alderman from the 23rd, entertain a second on that motion. Seconded by the Alderman from the 13th and the Alderman from the 2nd. All in favor signify by saying aye.
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 Opposed? We're adjourned. Thank you all. Have a good day.